A well-prepared emergency management system is essential for regions and communities to prepare for and respond to disasters and other emergencies. Children comprise more than 20% of the U.S. population and 25 to 30% of all individuals injured or affected by disasters. Children in disasters are vulnerable due to unique physical, behavioral, and social differences. Identifying the vulnerabilities at a community level and regional level can help these communities plan mitigation strategies to improve preparedness for children and families before disasters occur. This short video will describe 2 tools that can be used together to help you include pediatric and community considerations in your disaster plans. It is my pleasure to introduce to you today Dr. Deanna Dalgrove, PI of Region 5 for Kids and the Pediatric Pandemic Network for Rainbow Babies and Children's, and Dr. Nathan Tim, co-investigator for Region 5 for Kids with Cincinnati Children's.
The Regional Metrics Scorecard was designed to create a generalizable self-assessment tool that would be available to all communities and regions using accessible free data sources to inform areas of vulnerability for children and families. Subject matter experts were gathered to identify infrastructure and support mechanisms that are important to support children and families before, during, and after disasters in communities. 9 domains were identified: healthcare expertise, mental health, community resiliency, early education in schools, transportation services, public health jurisdiction, shelters, supply chain, and patient tracking and reunification. Open source databases were reviewed to identify data elements that support each of these domains. 3 domains actually had databases with data elements that were available: healthcare expertise, mental health, and community resiliency. The scorecard is currently available online in version 2.0. Use of this self-assessment tool at regular intervals, perhaps every 1 to 2 years, can assist regional entities and communities to evaluate the domain measurements that have changed as a result of mitigation strategies they have done.
This tool is a method of determining hazards impact on a region and how prepared regions are for pediatric consequences of each hazard. The Pediatric HVA template was developed to promote the inclusion of children and their unique needs into regional disaster preparedness. Through the physiologic and developmental vulnerabilities of pediatric patients, cause them to be disproportionately affected by disasters. They are often omitted from general hazard assessments. This Pediatric HVA is an interactive toolkit that allows users to assess individual hazards effects and existing regional preparedness across pediatric-specific dimensions, such as family reunification and child transport capabilities. The Pediatric HVA is not meant to be a thorough checklist of hospital emergency planning, but instead bring attention to how various healthcare facilities, emergency medical services, and other government agencies can work together to care for children during disasters. We hope that this tool raises potentially overlooked pediatric considerations, and regions can use it to demonstrate year-over-year preparedness improvements. Each hazard's impact and the region's subsequent preparedness are broken into human impact, healthcare system impact, and community safety infrastructure categories. As scores and hazard likelihoods are assigned, the tool produces a hazard impact and hazard vulnerability score that incorporates hazard-specific mitigation and preparedness. The template includes brief category descriptors to help users with scoring, and once completed, regions can view how all hazards impact and vulnerability scores compare to one another in an interactive dashboard.
Use of the Regional Metrics Scorecard in conjunction with the Pediatric HVA will allow communities to have a broader perspective of the vulnerabilities within their region that affect children and families as they prepare their disaster plans or revise their plans.
Both of the tools described today can be accessed via the QR codes on the screen. Should you have any questions, please feel free to reach out to Elizabeth Foster, Sherry Snyder-Pollock, or the Region 5 for Kids email address. Thank you.